Flossing isn't just good for your teeth, it may also help your heart and your brain health. Bryce Wylde, who is an alternative health expert, is here to tell us about the importance of flossing and why flossing is so important. So maybe we'll start there. Flossing, it's important.
Rick, flossing does far more than you think. So I've been so vested in this particular angle. Ever since clinical practice, we're taught to look in the mouth as a part of the body. No area of the body is untouched in the world of natural medicine because everything means something. It's a holistic approach. But so much you can tell from the mouth, the tongue, the state of the teeth. So we're not dentists. By the way, that profession, oral hygienists and dentists, were part of the first group in medical health care toward prevention, which is, we all know an ounce of prevention is worth a pound of cure. So cleaning your teeth and making sure you're getting updates with your oral hygienist is to prevent disease. Anyway, in natural medicine, we revere in highest regard oral health because this is now the latest science. It can translate to brain, as you mentioned, and heart disease. So we did a poll. We did an omnibus poll across the country, 1,500 people. It turns out 63% of us across Canada and in this region are not flossing daily. It's scary. And this is a 60 to 90 second effort. This is all it takes to prevent heart and brain disease. So it turns out bacteria in the mouth can land in the brain. Bacteria in the mouth can also get into your heart. And about 50% of people didn't know that in this poll. 70% had no idea about the brain. Here's how it worked. Now, if we can get uptight into this little tooth model here, most people don't realize, your teeth are not these sort of dead, bony protrusions. They're alive. And that's why we feel pain when they're infected. But these vessels in the gum line that feed the teeth and the gums, they are, when you don't get rid of the plaque between your teeth, they are what is going to translate that bacteria into general circulation, and that's how it's going to land in the brain or in the heart. So, I don't know, have you heard of P. gingivalis? Does that name ring a bell? So your dentist may have mentioned that before. You wouldn't have heard of Fucocobacterium and perhaps, not some of these other things like Streptococcus mutans, but these are the three evils that we know about that exist in the mouth, naturally exist, but we got to keep their levels, their population down. And when there's inflammation, the first sign of heart disease, by the way, might actually be bleeding gums.
Interesting.
So when there's inflammation, anything with itis, by the way, gingivitis, periodontitis, this is inflammation. When there's inflammation, there is bacteria escaping the mouth. What stays in the mouth? What is in the mouth doesn't stay in the mouth. It gets through into that circulation and into, the heart and brain. Is
there a right way and a wrong way to floss?
So there is, and I'm not a hygienist, but I can tell you what they've done. At companies like Gum, it's one of my favorite brands because they've made it so easy. These soft picks. I mean, I have these guys, next to my my couch when I'm watching TV in the news. When I'm watching CHCH, I'm doing these little. It's all about being interdental. So you can use standard floss. You can use these soft picks. You can even get into, these guys here. I have these guys in the car. These are great too, right? So I've got the man hands. It's hard to get, that string floss back there, right? But, these make it easy. The point is this, 60 to 90 seconds once a day. Brushing's important too, and we all want, clean, bright, white smiles. But brushing's not going to get interdental or between the teeth and get that bacteria out of the gum line. When I ask dentists, including my wife, by the way, we were talking off air. I've got 9 dentists in the family, and when I ask my wife and any other dentist for that matter, if you were stuck on a desert island, would you take, if you only had a choice to take one thing, floss or a brush? What do you think they answer? Most dentists.
Floss.
Floss. 70% of dentists are answering floss.
Interesting.
Because you can't do what you do with floss with a brush. I'm also a huge fan of, tongue brushing. Because there's a huge load of bacteria on the tongue. However, you could do it with a brush, but there are, tongue scrapers and so forth. But the point is, 60 to 90 seconds a day, you're probably adding healthy years to your life.
Yeah, absolutely. You brought in a couple of other things here. What's this?
Okay, so TikTok, Instagram, social media trends, they're talking a lot about oral health these days because it's for a good reason. We got to take care of our gums and our teeth. But coconut oil pulling, I don't know. You do anything for 4 or 5 minutes. So what this is coconut oil in the mouth, and you're swishing it, you're pushing it between the teeth. Okay, I get that. It makes sense. But it says, 4 or 5 minutes and then spit twice a day. If you're doing anything that long, you're probably with an advantage. But flossing is going to do a lot more. And then brushing with charcoal, probably too invasive, probably too abrasive for the teeth. Stick to regular, toothpaste. I like fluoride-free. I think there's evidence that we're overly saturated with fluoride.
Right.
So those are kind of things that we can debunk.
It's easy to do. You should be doing it before brushing or after, or does it matter?
It does not matter.
Okay.
If you're only going to brush once a day, and we hope you brush twice a day, it should be really importantly before bed.
Yeah.
You know, get all that stuff out of your mouth before you sleep 6 to 8 hours a night, hopefully, because then that's going to, bacteria love to thrive in a medium when there's food. So, you know, cavities are caused by sugar. They're caused by stuff stuck in your teeth. Yeah.
We got to go.
Yeah.
All the links to Bryce's website on our website, chch.com/morninglive. Good morning.